Racial bias is real, and it has measurable effects on healthcare outcomes. Today, we talk with Beverly Stoute about how unconscious racial biases play out in the therapy room.
Welcome to the Carlat Psychiatry Podcast, keeping psychiatry honest since 2003.
I'm Chris Aiken, the editor-in-chief of the Carlat Psychiatry Report.
And I'm Kelly Newsom, a psychiatric NP and a dedicated reader of every issue.
Psychoanalysis was built on the things we can't talk about, the stuff that gets suppressed, repressed, or otherwise goes unconscious. In Freud's time, that was sex and aggression. But what ideas do we shy away from in the U.S. today? Religion, politics, money, privilege, power, and race.
The issue of race so prompts excessive anxiety that it blocks off our capacity to think. Patients can come and talk about murderous, rageful feelings toward family members. But then if you ask them about a negative racial thought, they'll close up on you. In America, we don't talk about that.
That was Kirkland Vaughns from the documentary Black Psychoanalysts Speak.
The idea is that you can't keep the unconscious locked down forever. Sooner or later, it leaks out. And today, we're going to speak with psychiatrist and psychoanalyst Beverly Stoute about racial enactments in psychotherapy. But first, some terminology. An enactment is when two people, here the therapist and the patient, play out their unconscious biases or motivations without being aware of what they are doing. For example, suppose you're treating a patient with chronic depression who has an unconscious desire to be rescued. Meanwhile, you have an unconscious desire yourself to be a hero, a bit of a savior complex perhaps that you've never fully grasped, but that is part of the reason that you became a doctor. Here's how this might play out as an enactment. Every time you start a new medication, the patient feels rescued and gets better, only to collapse again into depression. This cycle of enacted placebo responses keeps repeating itself, much to the delight of both parties, but not toward any lasting recovery. Other enactments might not delight either party, as when we harbor unconscious biases about people with substance use disorders and react in a not-so-therapeutic way when they miss appointments or misuse our prescriptions. Now, let's hear from Beverly Stoute on how unconscious racial bias can get enacted in psychotherapy.
Throughout this interview with interspersed clips from the documentary Black Psychoanalysts Speak, which you can watch in full at blackpsychoanalystspeak.org or on YouTube.
The most common racial enactment in a treatment setting is silence, to pretend that race doesn't matter, which is really takes a lot of effort in today's world. So to treat someone and have them make comments all along the way and to pretend that it didn't matter. So for example, a patient I treated who had been treated by a white clinician before me, she had never really discussed certain aspects of her development. And the patient was not African American, although a person of color from another culture whose parents immigrated here when she was really young. And when she came to treatment with me, and after a while the treatment progressed, I began to see certain aspects that were being enacted in her work situations, and a kind of anxiety. She was the only one not given a mentor, which is not an uncommon thing for people of color. And she assumed it was her. And then finally, in our treatment, I opened up the issue of where that came from. And it turned out that she had had really horrible experiences of discrimination when she had moved here. And there had been a whole problem with immigration. And throughout most of her adolescence, she was exposed to being the only person of color in a really, really rural town. And what we discovered then was that her idea of herself, and this happens with children, whether it's African American, Southeast Asian, East Asian, when they're young, exposed to discriminating experiences, children don't really understand them. They incorporate them as some negative sense of themselves. And what we began to see was that her first treatment totally missed it. And these experiences had been traumatic, and it made it hard for her to feel comfortable in groups. You know, when she was being discriminated against, she didn't think that she could speak up because her parents had been immigrants and told her, look, you don't say anything, you just keep working hard. So in a treatment where you missed it, and you pretend that everybody is we're all the same and we're all white, then you miss it for a person who might actually open it up.
But there is this aspect of psychoanalysis I think can somewhat be attributed to Freud and Freud's attempt to flee his Jewishness. It is to assume that people are sort of generically the same.
He wanted psychoanalysis to be universal and not just a Jewish idea.
However, the generic human being happens to be a white male.
And yes, we're all the same in the sense that we're all different.
See, this is a way that I think is a different way of thinking than you hear in the popular media. I think that when we're talking about race and racism in treatments, we're talking about helping people understand these attitudes within themselves, sometimes the clinician. And this is part of the problem in the study that showed that not only that these things weren't adequately taught, but a lot of white clinicians were fearful of teaching them and were not prepared to teach them. And even when they wanted to talk about issues in the classroom, institutes are now beginning to understand that you can't teach this the same way. One of the parts of our study in looking at racial enactments was to show that you have to look at process as much as the content. So you can't have a class about race or anything about race and not have some kind of enactment because it's part of our culture. And what are racial enactments? So if you buy into the fact that the most simple enactment everybody knows, and that is when you go into treatment, who you are as a person and who your early object relations are, part of your conscious and unconscious. Who were your caregivers? Like traditionally mother and father, but now that can be a wide range of families, right? When you walk into the door and you talk to the analyst and you respond to them as an authority figure, that recaptures your unconscious world. And what do we call that? Transference. Transference is kind of like a mini enactment in a way. You act toward the analyst in ways you may not even be aware of that get at your internal world of object relations and unconscious. Okay. So what is an enactment? It's really saying that in groups and interpersonal relationships, you replay aspects of unconscious, both fantasies about people and object relationships in that situation, often without realizing it.
Some of these unconscious playouts are racial in origin, as you put it, stewed into us at an early age.
Right. They have to be. We live in a diverse society. So we have to, if we don't have the real experience with it, we have to have fantasies about it. If you watch TV, they're images. Your parents have given you some idea, depending on where you grow up in the country. You may or may not even have met people of diverse backgrounds, but it affects you whether you did or not. So all that as well is stored in your unconscious. It's sort of like when you see kids on the playground. Okay, well, if you're dressed in a different way, what's doing that? What's that? Yeah. I had a little kid who walked into my office who I'm evaluating for ADHD, a bouncy little adorable critter, and she walks in and says, "Oh gosh, I didn't know you'd be brown. I thought you were going to be white." I said, "Oh, really? Tell me about being brown. What are your thoughts?" So kids are like, that's one of the reasons I think I come to it from a more hopeful point of view, because I see children a lot. And so children will just tell you from the beginning, what it is. But all those ideas are stored up in our heads. And so racial enactments, what they do is we replay it. And if you think about it, it's like an unconscious script, but we're not really often aware of our racial attitudes. One, because people often don't think about them. And we live in a culture that tries to pretend they don't matter because they call up such difficult narratives about cultural trauma and cultural history in our country that have never really been fully navigated or healed. So I think it makes perfect sense then that you can see that a racial enactment is a replaying in group situations of what's largely unconscious for us.
One stereotype about psychoanalysis is that it focuses on you and what's in you and your internal conflicts and holds you responsible for your predicament. One could say, blames you for your predicament. If you're a person who's been oppressed, if you're a person who's been discriminated against, then there's a way in which that may implicitly minimize what's been done to you, your trauma. Here's this white guy going to tell me that I'm struggling right now because, not because I was discriminated against, for instance, but because of my internal conflict.
With racial enactments, one of the reasons I think they're so hard to understand is we're a little concrete when we think about race. So, race isn't really just about phenotypic skin color. When I teach candidates, I always say that race is a metaphor for many things. It can be a metaphor for the fact that we're different. It can be a metaphor for the fact that you have power and I don't. It can be a metaphor for many things. There are also unconscious fantasies that we have about how we think of race and the people who have been racial objects in our life stored in our mind. So that's what we come to. Example, a middle-aged white male visitor to a very liberal church attends one Sunday. And it's most like most churches of this particular faith that are 99% white. And he rose to introduce himself during the call for welcome to newcomers opportunity. And engaging in this way, he stood up and he shared how welcomed he felt. And he noted the warmth of the greeters at the door and the friendly way the Worship Association had invited visitors to stand up. And he said his name. And then he said he been to the church once before, and he returned because he'd encountered a very friendly Asian woman outside after the service with whom he'd had a lovely conversation. And to illustrate that fact, he began to recap their conversation, not by just fondly remembering it, but by imitating her speech. And his imitation became very uncomfortable for a person in the audience who was a Black woman, and also a member of that convocation who actually knew the Asian woman to which he was referring in the conversation. She thought this was a racial enactment because the gratuitous and stereotyped way and strained mimicking of the person's language came across of an ethnically and racially different person, exemplified a racial enactment that he took it upon himself as an authority to be okay with representing her that way in the group. The mimicking demonstrates sort of a tendency of people of a white dominant culture to reinforce what we colloquially call privilege by appropriating and belittling little aspects of the identity of a person of color whose culture persists no matter what we think as being seen as less than the dominant culture. Even when his conscious intent was to be warm and connected and kind, what came across was something that was probably not conscious in the way that he conveyed it. We know that anything that remains a conflict is not resolved doesn't actually go away. It acts in, covert ways that really can undermine.
Let's pause for a preview of the CME quiz for this episode. Earn your CME through the link in the show notes. According to Dr. Stoute, what is the most common form of racial enactment in the treatment setting? A. Indifference to the early experience of race. B. Pretending that race does not matter. C. Microaggressions. Or D. Interpreting racial differences as hostile.
I started by saying that many people who engage in this are not aware that they're engaging in it. They have good intentions. So can you tell us some examples of what might be a microaggression from a supervisor?
Well, one very simple one that is a real issue is people not pronouncing your name or shortening your name because they can't pronounce it or confusing you with someone else. I had a candidate where there was an enactment in their institute and who had been there like 5 years, and people just did not learn how to pronounce her name. And it wasn't a very complicated name, but it was very devaluing to her. So, and when you'd ask people, they'd say, well, we didn't learn. I said, well, if this is your psychoanalytic family, what does it feel like when people won't even learn your name after 5 years? Or one really typical one was the use of the N-word in the classroom, but not wanting to recognize that people would find that upsetting and harmful. And there were numbers of incidences in which in the way that was handled, ranging from saying I didn't say it to saying it's not a bad word, to creating an investigation where the candidate becomes the focus of having to be interviewed by multiple people by refusing to acknowledge that it not only affected the candidate, but everybody in the room. Then one incident becomes a huge enactment in an institute then when the way it is handled is not in a way that shows recognition of what the people in the room are feeling. There's an inability to say, let's talk about this in a helpful way. There is a denial that it matters. And that sets off a whole cascade of events that in a group environment can begin to negatively impact not only that group, but the people around them. Because we found out when this happens, it doesn't only affect that person, it affects everyone around them. So those are, I mean, I can go through more. Those are some examples of the ones that happen most prototypically.
Beverly Stoute is a child, adolescent, and adult psychiatrist and psychoanalyst and a supervising analyst at the Emory University and New York Psychoanalytic Institutes. She is the co-editor, along with Michael Slevin, of the 2023 book, The Trauma of Racism, Lessons from the Therapeutic Encounter. Last year, Dr. Stoute served as co-chair of the Holmes Commission on Racial Equality in American Psychoanalysis, and we'll talk with her about her findings of that report in our upcoming episodes. Check out our July issue online, where we talk with David Mintz about how to enhance medication response in a brief med therapy visit. And you can get $30 off your first-year subscription with the promo code PODCAST. Your support helps us stay free from industry bias.
Thanks for watching. Hit subscribe if you enjoyed this content. And to earn CMEs for listening, head on over to thecarlatreport.com/podcast.